Hello everybody, Dr. Jeff Lynch here with MckinneyDentist.com, and this is Dental Implant Talk. Today I'm going to answer the question, is dental implant surgery painful? Well, let me start off by saying patients are completely numb during any portion of implant surgery, whether it be tooth removal, implant placement, bone grafting, whatever it is we have to do. There is no pain that people feel during the procedure because we have them completely numb. Now, there's some different variables like sedation that can change the awareness of what you're experiencing. So let me talk about each different one of those and how it plays out. So let's start with sedation. There's three basic ways that you can have any oral surgery. You can be just numb and awake, maybe breathing the nitrous oxide or laughing gas. That relaxes some people. But if you're awake, what you'll experience is pressure or vibration. Of course, you're going to hear the sounds, but there is no pain during the procedure. Again, we administer local anesthetic that gets the area completely numb and usually lasts the majority of the day. That gives you an opportunity to take some pain medication before things wake up. Now, the first level of sedation is what we call conscious sedation. This is done by administering a couple little pills. These pills do not put you to sleep. Conscious sedation. You're conscious, you're awake. Now, some people may fall asleep, but this does not put you to sleep. What it does is it puts you into a dreamlike state, causes you to be very relaxed, not really caring about what's going on. And in the majority of people, they don't have any memory of what we did. You can still respond to any commands if there's something we need to do to have you bite or chew, anything like that where we're checking things, you're able to respond to us. The next level of sedation is IV sedation. IV sedation is administered by a MD, an anesthesiologist in our office, and you are asleep for it. Now this type of sedation, you're still breathing on your own. This is similar to the sedation that many of you have had with a colonoscopy. So you get an IV, you get medication through there, you fall asleep, you stay asleep through the entire procedure, you breathe on your own, and when we're done, you wake up very quickly, and generally you're walking out the door, or more appropriately being wheeled out the door 20 minutes later. So the medication takes effect quickly, it wears off quickly. On either of these sedation options, you're going to be at home, resting, not able to do anything that requires decision-making processes because you're going to be under the influence of these drugs for about 24 hours. But after the oral surgery procedure, that's what we want you to do anyway. We want you to be home and resting, taking medication, having ice on it. But again, any of these, the procedure itself is not painful. Now, after the fact, post-op wise, there's different parts to implant surgery. The removal of the tooth probably gives the majority of people the most pain afterwards, though it's not that bad from what they say. Because of the fact that when we take a tooth out, we're putting the implant down in the socket or a bone graft, we're always using patients' growth factors. When we start these procedures, we'll draw blood and we'll concentrate the portion of your blood that's responsible for healing and tissue repair. And we mix that down into the socket. And when we're done, the socket will be completely covered up and closed. So there is no opportunity, no chance to get a dry socket. Dry sockets happen when you lose a clot in an extraction site, most commonly wisdom teeth, where nothing is placed down in there. Blood pools in, it clots. That's the basis on the healing process. But if you lose that clot, that's when a dry socket happens, and that hurts. But again, with implant-related surgery, there's never an open socket, so dry socket is not something that can happen. Now, if we're going to a site and we have just the implant being placed, patients generally report that Tylenol or Advil is all it takes to stay comfortable after this procedure. Again, it's not adding the implant back is nothing compared to removing the tooth. And then when we get to the point of restoring these, generally there's no local anesthetic even being done. Everything is a matter of impressions or scans and taking little screws in and out of the implant itself. We're not doing anything to the gums or the bone, so there's no need for anything there, and completely painless. So I hope that answers that question. Thanks for listening. Look forward to meeting you at MckinneyDentist.com.